Hello, and welcome to another episode of Improve Healthcare, the show that focuses on ideas and insights to improve healthcare delivery around policies, processes, and patients. I'm your host, Rich Greenhill. For this episode, we'll focus on health equity, patient safety, and quality improvement with Dr. Knitasha V. Washington. Dr. Washington is recognized nationally for her leadership and work in health equity and stakeholder engagement. She's the president and founder of ATW Health Solutions. She's dedicated a lifelong commitment to service and building viable partnerships to raise the national standard of healthcare for quality, safety, and health equity. With more than 20 years of experience as a healthcare professional, she's gained international prominence for her successful leadership and collaborations with World Healthcare Systems, United States government agencies, community health advocacy groups, and government policymakers, helping them through some of their most complex structural and organizational challenges. Dr. Washington serves as a board of director for the National Quality Forum and the Fertile Ground Foundation. She has a Doctorate of Health Administration and Certificate in International Health Studies from Central Michigan University, Masters of Health Administration from Governor State University, and a Bachelor of Arts with a focus in business from Chicago State University. So it's my pleasure to welcome you today, Dr. Washington. How are you?
I am awesome.
And I just have to tell the audience here how you inspired me to get my DHA. You know the story, but you were the president of the National Association of Health Services Executives in Chicago in the 2000s, and I was still in the Navy, and I saw your name, and I thought, wow, she is really rocking it, and I want to understand what a DHA is, and so you were my inspiration, and so that's something that is just a big deal, and it's very special to have you today.
Thank you, and it is all the more inspiring. When you think about your journey, because I think about just what it took to get through that program, right?
Mm-hmm.
And to know that your work would inspire someone else, right? And so I learned this like after you graduated, you've gone on to do these great things. But to know, that your work is not in vain is the blessing in it all. And so I'm grateful for that.
Yeah,
So
that's great. And I'm just thrilled to have you. Well, let's talk a little bit about ATW. So would you give us a sort of insights on what you do, as your president of your company, and what are some of the things you have going on right now?
Yeah, absolutely. So ATW Health Solutions started the organization actually back in 2014. And we are an advisory consulting firm that focuses on quality improvement with an emphasis on engagement, patient engagement, and health equity. And the short version is that, through all of my years, working with hospitals and health systems, and then also living this separate life, if you will, in public health and research in disparities. During the early years, it was taboo to think that health services delivery would even consider health equity, right, as a concept or as even a part of the conversation, right? And so I just recognized early on, that health equity and engagement needed to be strategically integrated in all of our quality improvement efforts. And I decided to build an organization focused on that.
That's wonderful. So if there was no road, so you built a road. So that's awesome.
Yeah, I guess you can say it's a little itty bitty road, but it is a road. And I think over the years, in the early years, we really focused more on learning, training, education, right? It was really about, getting people to see the bigger picture, right? And
Mm-hmm.
helping to kind of pave the way. And then, the the doors began to open in terms of a little bit of alignment between public health and health services delivery when you began to see a bigger focus on population health
Mm-hmm.
management. Now, I have my, own opinions about the way in which, many health systems went about, doing that work. But I'll just say that I believe that the intention was in the right spirit in terms of the way we use strategy, right, to eliminate disparities. And so now the way I see it, we've entered into the second phase of it, where I believe that we will see, you know, a real intentional focus on improving quality by addressing equity and addressing, the elimination of disparities. So I'm excited to, just be a part of this era and this movement, because I do think we'll be, see a lot of change.
Yeah, you're doing some really awesome things. I was looking at your offerings earlier, and your PFE, person and family engagement. Would you talk a little bit about that? Now, that's aligned to equity, right?
Yeah,
Right.
yeah. So I'll tell you where that really started. So in around about 2011 or so, when I first started working with the Department of Health and Human Services, CMS. So the Centers for Medicare and Medicaid Services began to do a lot of these innovations projects. And one of the large scale quality improvement projects that I was blessed and honored to serve in leadership was the Partnership for Patients. And that campaign actually came up under um, a former administrator, Kathleen Sebelius, and Director Sebelius really, created this focus on eliminating harm, so reducing hospital-acquired conditions within the hospital setting by 20%, and also reducing readmissions by the same. And that was a real opportunity for me to start a lot of that foundational work around integrating equity into our quality improvement efforts. And I'm proud to say that I was able to do that with over 4,000 hospitals participating across the country.
Wow.
But as a part of that, the another fundamental piece of the work was what CMS had described as what they call person and family engagement. And in industry, it was beginning to take root as patient and family engagement. And basically, what the term means is that that we, as within healthcare delivery, are mindful of the values, beliefs, and perspectives of patients in the work that we do. And we use those voices to help transform the healthcare system and improve quality and improve safety. And so think about it from the context of any other industry. You think about, the beverage industry, and you think about, years ago with like, Coca-Cola and Pepsi, right? Well, they would have these taste tests, right? And consumers, right, would provide their opinion on the beverage and the ingredients, so on and so forth. And it's no different. Patient engagement is no different. It's allowing those who actually use the healthcare system to share their lived experiences, such that we learn, right, through the eyes of the user, of the ultimate user. And so it's actually been used in other industries, like you think about GE. I'm certain that you, with your Lean Sigma, Six Sigma background, about voice of the customer. It's the same. It's the same concept.
Absolutely.
And so CMS wanted to make certain that we were engaging patients in that quality improvement work. And the demand that was placed on me and those partners that I was working with was to build a network, and that's what we did. So as I continued to, matriculate over the years, I decided when I built my company that I was going to build my own virtual network. And so the Patient Partner Innovation Community is a virtual network of diverse individuals from all across the country. We have more than 1,000 people that are a part of the network. And these are individuals that actually contribute to quality improvement work. They contribute to research. They contribute to measures development. So, for a great example, is that one of the contracts that we have right now is with CMS, and it's with their measures development teams. And so, our network actually identifies patients to be a part of those measured development teams. So think about, CMS basically saying, okay, well, we're going to build a measure on around maternal health. And that maternal health team of researchers and measures developers are looking for the voice of patients, real people, to help them shape that work.
Wow.
And our company actually contributes to that by identifying, recruiting, educating, bringing them into the work. So yes, I'm proud to be able to say that we don't just talk about it, we be about it. So we actually bring real people into the consultative work that we do transforming healthcare.
That's really great. It's as I think about it, just in my own lived experiences, being African American, when if we're all given the same treatment, right, the same medicine, we all eat different foods, right? You could be Latino, you could be African American, or whatever, right? And so eating, as you know, is part of our culture, right? It's part of the thing we do on Sundays or different times. And so to tell me now I can't do that in order to move a health indicator, how might I react? And so I think that that's marvelous work that you're doing, because it's really focusing on trying to reduce those disparities through, like you said, engaging people. What do you need? Not I'm going to tell you what works, but let's tailor that to what your needs are and your culture and your mindset and mental models about it, and not just here's some medication, take it.
Yeah, absolutely. And you'd be surprised, the way those perspectives actually shape outcomes. And how not only do they, shape the solutions that we develop, but it has a real positive impact on, what we want to see as an outcome. There's some research that we've been doing here in Chicago that's been funded by PCORI,
Okay.
which is the Patient Outcomes Research Institute. And uh, PCORI's, the work that we're doing through PCORI, it's called 2 Series. That work is stroke disparities work. And we bring real people from the community into the work to help us understand what's going on in the community. And, what's really interesting about it is when you give people a platform to live in in their authentic space,
Mm-hmm.
right? But to share with you context that really shapes, the world in a different way. Because here it is as a Black woman,
Mm-hmm.
and I'm hosting focus groups with other Black individuals, and I'm wanting to know what are some of the reasons why, they believe that we don't call 911 in the event of stroke. And when you hear another person that looks like you tell you, well, I wouldn't call 911 because my son is on house arrest, police coming to my home because they might take him back into custody,
Oh,
right?
wow.
And when you hear that not once and not twice, but you hear that as a common theme that begins to develop when you're doing this work, um, it really is a humbling experience, and it really helps ground you in the why this work is so important, and that one singular voice can't even be a voice for all people. Because again, as a Black woman that's had my own experiences in the health system, have children, experiences with my parents, so on and so forth, one would think that my perspectives are valid. Well, yeah, they are. But the reality of it is, from region to region, city to city, these things could be very different. Meaning, your relatives in Tennessee the way in which they might manage it is a little different from the way we might manage it here in Chicago. And so it's those differences that we have to pay great respect to
Mhm.
and bring value to, and bring that into the work so that we can actually get to the outcomes that we want to see.
That's great because no group of people, are a monolith, and that's one. And then we all are different, and so getting to the point where we can tailor care to what people need, it's more work. But if we truly want to move outcomes and improve population health, I think that's the way. Well, we got right into the business, but I'm just very curious. How did you get started in this, and what inspired you to do this work? I mean, this is really great, honorable, and in some ways sacrificial work that you're doing, because you're going out and trying to be a voice for the voiceless, if you will, around helping them. So how did you get started?
So that's a great question because, looking back, there always was this, um, uh, uh, I'll say, burning desire to live in my truth and to allow that to be a part of my career. And the reason why I say that is because when you're trained as a healthcare professional and you're working in the healthcare system, you're trained to do it the way it traditionally has been done, right? And
Yes.
so the things that I talk about in quality improvement aren't the things that you read about in textbook, which is the reason why I've always loved to teach and serve as adjunct, because it was an opportunity or platform for me to really set the record straight about what people will experience and see, right, in the healthcare environment. And so there was quality improvement. And then there was what I experienced and what I saw in my own community.
Hmm.
There was what I learned through my years in, health disparities research. There was what I learned through my colleagues and mentors through NASI, right?
Hmm.
And there was what I saw and experienced in health systems that I worked for across the country, right? And there were huge gaps, just huge gaps. But it wasn't until I actually lost my dad to preventable medical error that really became that earnest callus that really pushed me and said, no, this is what you have to do, because it was in that circumstance that I was able to more clearly see how um, uh, the concept of equity and the concept of engagement really needed to be strategically embedded in quality improvement work
Hmm.
if we were going to truly improve for all people. And so that's how we started. To be honest with you, I mean, ATW Health Solutions was built and named in my father's legacy, and my work in quality improvement continues to focus on engagement and focus on equity, and hopefully, uh, we'll continue to see that more front and center in healthcare as the way in which we approach the work, as opposed to an afterthought.
Wow, that's truly inspiring. I'm very sorry that you had to, lose a family member to this. Being in this 100-year pandemic right now, it's interesting because it was like the thing that ripped the scab off of an issue that we knew was going on, but I think every
That kind of we knew what the heck was going on. I mean, we knew. You know what I'm saying? Those of us who have lived this, we knew.
right.
And I'll be honest with you, there was 2 weeks that I literally went into hiding. Like I didn't want to talk to anybody.
Hmm.
Don't send me an email. Don't, because I was thrown aback by two things. First, there's COVID-19, and before the numbers started to show forth in terms of the disparities numbers, you all you had to do was watch the television and you see the stories, and I knew, and my heart knew that we would see a disparities issue here. And so, sure enough, as state by state, as they began to share their race and their COVID-19 data stratified by race and ethnicity, there it was exposed, right? And I'll be honest with you, it was like a dagger in my heart because I felt like, wow, all of the work, that I felt like I had contributed to, um, all of the time spent, and to see this front and to see people dying daily, people that I knew, family members of mine, family members of people that were close to me. It was really a hard thing. And then on top of that, the death of George Floyd, and to see Black Lives Matter movement come behind that. I'm telling you, it silenced me for a minute because it was just that devastating. Again, it was really because when you're living it, you know it and you see it, and then the rest of the world kind of responds like if this was something brand new. It really hurt. It hurt, and so I had to gather myself, and focus on self care, which is something that I had not been doing. Um, and really begin to encourage myself, to get back to work. And so here we are.
Yeah, I had a similar reaction. I think I struggle just because I think I knew, but I think I didn't really know maybe as well as you did because you're in the trenches there doing that work. And so it leads me to this next point, and I have to be honest. Tuskegee is not the only issue that we've seen. If you read, there's several organizations around the country in recent years who have had some issues, and which is why those of us in academia you have to go through such stringent rules to do research, right? It's for that reason. But I wonder what your thoughts are about the vaccine, right? And I'll just say up front, initially, my background's in medical laboratory science, so I understand the whole, how they make vaccines, and I was a little skeptical at first. Having siblings that are all nurses, they got the shot before I did, which is kind of interesting. But I went ahead and got my vaccination. But how do you think, we help different communities of color and of all folks who are skeptical about the vaccines? How do we get them over that hump that, there's not some mass idea to get rid of a bunch of people by inoculating us all. It's really, we need to have some level of protection.
So I'll start off by saying first, I have gotten my first vaccination shot, and proud to say that I have moved forward in that light, and I think that to your point about Tuskegee, I think we're in a different space. Think about it from this perspective. So just consumerism is different, right? Our ability to be able to get knowledge and information is very different. And so how messages travel and the messages that we receive, those things are important to understand. And I think that just because information is far more easily accessible, we have to make certain that we are very deliberate and intentional about the information that is important to these communities. So oftentimes, and similar to the engagement conversation that we just had, oftentimes we give them what we want to give them, or we give them what we believe they need. But they're out, actually asking for something different. And so when you're able to partner with communities and people in that way, to really understand what is it that they want. It's like being married. It's like, being in a relationship. Like, what is it that you want out of it? What is it that you want the reciprocating value, to be? And well, they're looking for, integrity. They're looking for the authenticity and leadership. They're looking for that level of transparency. The first thing that we have to do is really make certain that we understand that we're answering their questions. I don't think nobody's really asked the question. Everybody's just basically saying, here, we got, here's vaccination here, here's a vaccination there. And, there might be a little bit of information moving around in terms of the type of medication and who the manufacturer is. But I don't know that we've really answered the questions that, the community has. And so our messaging has to answer their questions. And I'll tell you this, this was during the holiday season. There was a drive-by turkey giveaway that I had went to. And I was there because of the stroke disparities research that we're doing here in Chicago. And the community leaders basically said to me, now, Knitasha, we want you to go back. We want you to find out how many Black people were in them trials. We want you to find out, and so I'm listening to them and I'm saying, you know what? These are educated people that are being discounted, meaning, these are valid questions that they're asking, but no one is asking them, what do they want to hear from us, right? What information do you really want? So that's the first thing. We got to engage them differently. And so I think the modes in which we also partner with the community is critical to get this work done. One thing we just expect, because, we've got, droves of vials of vaccines that folks are just going to come in droves to get them.
not
Well,
so
not,
much.
not disenfranchised folks. You know what I'm saying? And so we have to really be respectful of that. We have to be mindful of that. And we have to think about non-traditional ways to make certain that we are getting those medications to them, or the vaccinations to them. I know that, here in the city of Chicago, Mayor Lightfoot has done a great job of getting that out to through the churches, right? Which is really huge, in particular in the African American community and the Latino community. So I think that that's very important. But I do also think that we have to be looking at our community health models. And there's probably at least 5 seniors that I can think of right now that are at home, are not frequent drivers, still aren't vaccinated, want to take a vaccination, have to go online and really don't know how to do that. So I'm asking the question, okay, who's calling those folks? What providers are we partnering with? And, who's community health nurse practitioners are pulling up at their homes with vaccinations ready to go. So our engagement strategies have to be different. So I think that that's really, the answer to your question is, number one, we got to, be brave enough to just ask them, what do you want to hear from us? What is it that you want to know? Right. Because we haven't done that. And then we need to craft messaging around it. And then number 2, after we do that, we need to deploy in the way in which they're saying that they want to have it done. I mean, that's what partnership is about. That's what engagement is about. And that is how you actually begin to see more equitable outcomes. Because when you give people something to be a part of and believe in, they will go along the journey with you. Right. But you can't just put it out there and tell them this is what, we want you to do, because of all the mistrust, because they have been disenfranchised, and because of all the other social determinants that impact their inability to be able to, meet us where we are. We have to meet them where they are.
That's fabulous. It's like you said, it's engagement, and it's also really respect. That's what I heard. You respect them by asking, and then by listening and doing. And I just want to take a moment and thank you again. This has been such a great. I could talk to you all day. This is such a great discussion we've had, and you're doing some really fantastic work. You have fantastic ideas, and I wish ATW and you nothing but the best, because I think that what you're doing is important. I know it's important from my vantage point, and I think others see that too, which is why you are so renowned around the country and the world. So thank you for coming today.
I appreciate you. Thank you.